Hello there. My name is Dr. Evelyn Hart, and I've spent over 40 years as a geriatric health specialist, helping thousands of older women regain their confidence, strength, and independence. But today, I want to tell you something personal. Just last year, I got a call that shook me to my core. My dearest friend Linda, 78 years old, vibrant, full of life, slipped in her kitchen and shattered her hip. One fall, and everything changed. She lost her mobility, her confidence, and her freedom. And here's the hard truth. It didn't have to happen. Most people think falls are just bad luck. But in reality, they're often caused by a handful of subtle, preventable mistakes. Mistakes that too many older women make every day without even realizing it. I've seen it again and again. Wearing the wrong shoes, standing up too quickly, ignoring small signs of imbalance. That's why I'm here today, not just as a doctor, but as someone who cares deeply about your safety and quality of life. In this video, I'll reveal 6 common mistakes women over 60 make that quietly lead to imbalance, weak legs, and dangerous falls. Some of them might surprise you, or even scare you. But by the end, you'll know exactly how to stand stronger, walk safer, and protect your independence. So let me ask you, what if preventing one small mistake today could save you from a life-changing injury tomorrow? Stay with me, because this may be the most important message you hear this year. Let's start with one of the biggest hidden dangers, your shoes. Yes, that cute pair of slip-ons or the comfy house slippers you've worn for years might be silently working against you. As we age, the structure of our feet changes, arches flatten, balance shifts, and our joints become more sensitive. Yet, most older women are still wearing shoes that were never designed for aging feet. Thin soles, no heel support, loose fit, slippery bottoms. These can all increase your risk of falling, throw off your posture, and worsen joint pain in your knees, hips, and lower back. In fact, one of my patients, Carol, 72, suffered a painful fall simply because the sole of her favorite flats had worn smooth. She didn't even notice until she slipped on her front porch. So what's the solution? Look for supportive footwear with non-slip soles, cushioned insoles, and a snug, but not tight, fit. Shoes with a slight heel, no more than 1 inch. Good arch support, and a wide toe box can do wonders for your balance and gait. And please, ditch the flip-flops and backless slippers. They might feel easy, but they're anything but safe. Your feet are your foundation. And the right pair of shoes could be the difference between a confident stride and a devastating injury. Before we move to the next mistake, do me one favor. Hit that subscribe button and turn on notifications. Because every week, I, Dr. Evelyn Hart, bring you practical, science-backed tips to help you stay strong, safe, and independent after 60. Let's take this journey together, one step at a time. In the right shoes. One of the most common mistakes I see among women over 60 is wearing shoes that are simply not up to the task anymore, especially old shoes that have lost their support and grip. I can't stress enough how dangerous this can be. When shoes get worn out, the soles become thin and uneven, cushioning flattens, and the tread that prevents slipping wears down. Even if they look fine on the outside, inside they may no longer provide the stability your feet and ankles desperately need. This leads to poor balance and increases the risk of falls. I've treated many patients who didn't realize their favorite shoes had become hazardous until they experienced sudden dizziness or a fall. One woman told me, "I always thought my shoes felt comfortable. But after a fall, I learned comfort isn't everything." So what should you look for in a safe shoe? First, choose footwear with a firm, sturdy sole. Something that can absorb shock but won't be too soft or flexible to cause instability. The heel should be low and wide enough to provide balance without tipping your foot. Next, a good cushioning system is critical. It helps protect your joints from impact, especially if you have arthritis or sensitive knees. Memory foam or gel insoles can be excellent options. And don't forget about traction. The bottom of your shoes should have a non-slip, textured sole to help prevent slips on smooth or wet surfaces. This is crucial for everyday safety. Finally, make sure the shoe fits well, snug enough to hold your foot securely but roomy enough so your toes can move freely without pressure. Wearing the right shoes isn't just about comfort. It's about protecting your independence and preventing injuries that can change your life. Your feet are the foundation. Support them wisely. Another critical mistake I often see among women over 60 is neglecting muscle strengthening exercises. As we age, muscle mass naturally decreases, a process called sarcopenia, and this loss of muscle strength can seriously affect balance and stability, making falls much more likely. I can't emphasize enough how important it is to keep your muscles strong. Weak muscles mean your body becomes less able to support itself, leading to frailty, slower reactions, and poor posture. All of these factors increase the risk of falling. Many women think that exercise has to be complicated or strenuous to be effective. But that's simply not true. Even simple, gentle movements can make a huge difference in maintaining muscle strength and improving balance. Some of the best exercises I recommend include squats, which strengthen your thighs and glutes, the main muscles that keep your legs stable. Then there's the wall push-up, a great way to build upper body strength without putting too much strain on your joints. You don't need to do dozens, just a few sets of 8 to 12 repetitions, 2 to 3 times a week, can help rebuild muscle mass. If you feel comfortable, you can also add light hand weights or resistance bands to these exercises. Even 1 to 3 pound dumbbells can provide the resistance needed to stimulate muscle growth safely. Consistency is key here. Just 15 to 20 minutes a day dedicated to these simple strength exercises can significantly improve your balance and reduce your risk of falls. Remember, building muscle isn't just about looking fit, it's about creating a safer, more stable body that can support you well into your later years. Taking these small steps will empower you to stay independent and active longer. One more crucial factor that many older women tend to overlook is changes in their vision. As we grow older, our eyesight naturally declines, and this can have a serious impact on our ability to move safely. Poor vision affects how well we perceive our surroundings, making it much easier to misjudge distances, trip over objects, or miss steps. I've seen countless cases where seniors have experienced falls simply because they didn't realize their eyesight was deteriorating. When you can't see clearly, your brain struggles to accurately interpret the space around you, which can cause unsteady steps and balance problems. So, what's the solution? First and foremost, it's essential to get regular eye exams. Even if your vision seems fine, a checkup every year or two can catch problems early, such as cataracts, glaucoma, or changes in your prescription. If you wear glasses, make sure your prescription is always up to date. Wearing glasses that are too weak or too strong can distort your vision, which is just as dangerous as poor eyesight itself. I recommend having a backup pair of glasses as well, in case your primary pair gets damaged or lost. Another simple but effective tip is to improve lighting in your home. Make sure rooms, hallways, and stairways are well lit to help you see potential hazards more clearly. Consider using brighter bulbs or adding night lights to avoid stumbling in the dark. Pay attention to glare and shadows, which can also confuse your eyes. Adjusting curtains, blinds, or lamp placement can make a big difference in creating a safer environment. Taking care of your eyes is not just about reading or watching TV. It's about maintaining your independence and preventing falls. Don't let poor vision quietly increase your risk when there are so many ways to protect yourself. Another critical issue that many older women, including some of my patients, often overlook is the side effects of their medications. As we age, it's common to take multiple prescriptions to manage different health conditions. However, some of these medications can cause unwanted effects like dizziness, lightheadedness, or loss of balance, all of which significantly increase the risk of falling. I remember Mrs. Thompson, a lovely 72-year-old woman, who came to me after a few falls at home. It turned out that one of her new medications was causing episodes of dizziness that she hadn't linked to her falls. This is not uncommon. Many seniors don't realize that certain drugs, especially those for blood pressure, sleep, or anxiety, can affect balance and alertness. The key to preventing this is listening to your body carefully. If you start feeling unusually dizzy, weak, or off balance, don't ignore it. Take note of when these symptoms occur and discuss them promptly with your doctor or pharmacist. They can adjust your dose or suggest alternative medications that might be safer. Never hesitate to ask questions about potential side effects when you start a new medication. Being proactive about your health and medication management is essential in protecting your balance and preventing falls. Remember, the goal is to maintain your independence and safety. And sometimes that means being your own best advocate when it comes to your medicines. One more mistake I often see among older women struggling with balance is relying too much on furniture, like chairs, tables, or countertops, for support while walking or standing. I completely understand why this happens. It feels natural to grab onto the nearest stable object when you feel unsteady. However, using furniture as a crutch can be quite risky. Chairs and tables aren't designed to support your weight in a safe and stable way, and they can easily shift or tip, leading to a dangerous fall. I always tell my patients that using the right mobility aids, like a cane or a walker, is a smart and safe choice, not a sign of weakness. These tools are specifically designed to provide the support and stability your body needs. When used correctly, they can greatly reduce your risk of falling and help you move around with more confidence. For example, a cane with a sturdy rubber tip offers solid traction and can be adjusted to the right height for your comfort. Walkers provide even more stability and are especially helpful if you feel very unsteady or have trouble walking longer distances. It's important to learn how to use these aids properly, Your healthcare provider or a physical therapist can show you the correct techniques so you can get the most benefit without causing strain or discomfort. Remember, there's absolutely no shame in using a cane or walker. Choosing safety and independence is always the best option. Don't wait for a fall to force you into using these aids. Embrace them early, and you'll protect your health and your freedom. Another crucial mistake I often see among older women is neglecting exercises that specifically improve balance. Balance isn't something fixed, it's a skill. Much like riding a bike or playing piano. And if you don't practice it regularly, your body can lose its ability to stay steady. This natural decline in balance increases the risk of falls, which can lead to serious injuries. I always remind my patients that balance training is not just for athletes or younger people. It's essential for maintaining independence as we age. Simple exercises can make a huge difference. For instance, standing on one leg for 10 to 20 seconds helps strengthen the muscles that keep you upright. Walking in a straight line, heel to toe, challenges your stability and trains your brain to coordinate better. Another effective method is shifting your body weight slowly from side to side or front to back while standing. These movements help your inner ear and muscles work together to keep you steady. The best part? These exercises are simple, require no special equipment, and can be done safely at home. Incorporating balance training into your daily routine can help you regain confidence and reduce the risk of dangerous falls. As always, if you're unsure, consult with a physical therapist or healthcare professional who can guide you through safe techniques tailored just for you. As we wrap up, I want to leave you with a few heartfelt pieces of advice that have helped so many of my patients regain their strength. Confidence and joy in life. First, remember that age is not a barrier, it's simply a number. Every small step you take towards better balance and health is a victory. Celebrate those wins, no matter how small they seem. Don't be afraid to ask for help or use tools like canes or walkers if you need them. True strength comes from recognizing when support will keep you safe and independent longer. And most importantly, stay consistent. Daily movement, whether it's a few balance exercises or gentle walks, builds resilience over time. Surround yourself with positivity, friends, family, or a community that encourages you to stay active and engaged. Motivation often thrives when you have people cheering you on. Remember, your body is your home, and it deserves care and respect every day. Taking time to nurture it with proper footwear, exercise, and regular health checkups can make all the difference in preventing falls and maintaining your independence. Believe in yourself. The power to stay steady and strong lies within you. I'm here cheering you on every step of the way. Stay safe, stay active, and keep moving forward. Throughout our journey today, we've uncovered some crucial truths about staying steady, strong, and safe as we age. The key message is that balance and mobility are not just physical abilities, they're the foundation of independence, confidence, and a fulfilling life. Small choices, like wearing the right shoes, exercising regularly, paying attention to our eyesight, and being mindful of medications, add up to big impacts on our overall well-being. It's never too late to start caring for yourself in these simple but powerful ways. Remember, aging gracefully doesn't mean giving up control over your body. Instead, it's about embracing new habits that protect you and empower you to live life fully. Whether it's practicing balance exercises, using a walking aid without shame, or simply being proactive about your health, these actions honor your strength and resilience. I'm Dr. Evelyn Hart, and I invite you to take these lessons to heart. Make a commitment today to prioritize your safety and balance, not just for yourself, but for those who love and depend on you. If you found this video helpful, please like and subscribe to Senior Moments Matt. Your support helps us continue sharing valuable insights to keep our community strong and informed. Also, I'd love to hear from you. Share your thoughts about this story. Ask questions, or tell us about your own experiences with balance and mobility. Let's learn and grow together. Stay steady, stay strong, and take good care of yourself.